You check your blood pressure. You see two numbers, and you've been told to watch both of them. But there is a third measurement hiding inside those two numbers. Most doctors never mention it. And after the age of 65, cardiologists say it may be the most important one of all. It takes 5 seconds to calculate. It requires no extra equipment, and it could tell you something about your heart that your regular blood pressure reading has been missing entirely. By the end of this video, you will know exactly what this number is, how to calculate yours right now, and what the research says you should do if it's too high. Let's start with what you already know. When you take your blood pressure, you get two numbers. The top number is called your systolic pressure. That is the force your heart exerts when it beats and pushes blood through your arteries. The bottom number is called your diastolic pressure. That is the pressure in your arteries when your heart is resting between beats. Most of the attention from doctors, from patients, from health guidelines goes to the top number. Systolic pressure gets the headlines. Diastolic pressure is almost completely ignored. As UAB cardiologist Dr. Jason Guichard has noted, physicians often focus on the single systolic number, and diastolic pressure is largely overlooked in routine appointments. That is a significant gap, because the number hiding between those two measurements tells a story that neither one tells alone. As always, nothing in this video is medical advice. Please consult your physician before making any changes based on what you learn here. What this video will do is give you the information to have a much smarter conversation with your doctor at your next visit. The number your doctor is probably not mentioning is called your pulse pressure. It is the simplest calculation in medicine. You take your systolic number, the top one, and subtract your diastolic number, the bottom one. What's left is your pulse pressure. Here's an example. If your blood pressure is 120/80, your pulse pressure is 40. That is considered normal. 40 millimeters of mercury is the target. But here is what changes after 65. As we age, our arteries naturally become stiffer. The elastic proteins that keep them flexible, called elastin, gradually break down. Stiffer arteries cannot absorb the force of each heartbeat the way they used to. The result is that your systolic pressure, the top number, tends to rise, while your diastolic pressure, the bottom number, tends to plateau or even fall. The gap between them gets wider. That widening gap is your pulse pressure rising, and research shows it matters enormously. Here's what the research actually says. The Framingham Heart Study, one of the longest-running cardiovascular studies in history, found that every 10-millimeter increase in pulse pressure was associated with a 23% increased risk of coronary artery disease. Not a small number, 23% for every 10 points. A separate trial called the systolic hypertension in the elderly program found that every 10-millimeter increase in pulse pressure raised the risk of heart failure by 32% and stroke risk by 24% in older adults. And a 2000 meta-analysis confirmed that a 10-millimeter increase in pulse pressure was associated with a 20% increased risk of cardiovascular mortality. These are not minor statistics. These are numbers that cardiologists pay close attention to, and yet in a standard blood pressure check, pulse pressure is almost never calculated. Take out your last blood pressure reading right now, or take your blood pressure if you have a cuff at home. Subtract the bottom number from the top number. What do you get? Hold that number in your mind. We're going to tell you exactly what it means in just a moment. So what is a concerning pulse pressure number after 65? A normal pulse pressure is around 40 millimeters of mercury. Most cardiologists consider anything above 60 to be wide, and a meaningful risk signal, particularly in older adults. Research published in cardiovascular literature indicates that a wide pulse pressure over 60 millimeters of mercury in seniors is an independent risk factor for heart attack, stroke, and heart failure. The word independent is important here. It means the risk exists even when your systolic and diastolic numbers individually look acceptable. You could have a blood pressure reading that looks fine at first glance and still have a concerning pulse pressure. This is exactly why cardiologists argue the number deserves more attention than it gets. Here's a practical guide to reading your own pulse pressure number. If your pulse pressure is under 40, this is actually low and may warrant its own conversation with your doctor. It can sometimes indicate the heart is not pumping with enough force. If your pulse pressure is 40 to 60, this is the normal to mildly elevated range. For most adults, over 65, some widening is expected and not immediately alarming. If your pulse pressure is above 60, this is worth a specific conversation with your doctor. Not panic, but a specific, informed conversation. If your pulse pressure is above 80, most cardiologists would consider this significantly elevated and want to investigate the underlying cause. Here's the part most people find surprising. Your blood pressure medication may be treating your systolic number perfectly. Your readings may look controlled, and your pulse pressure could still be widening without anyone noticing. What causes a wide pulse pressure and what can you do about it? The primary driver in older adults is arterial stiffness. As we age, the walls of our large arteries, particularly the aorta, lose their flexibility. This is a natural process, but it can be accelerated by several things. High blood pressure that has been poorly controlled over years, chronic inflammation, high blood sugar and diabetes, smoking, and high sodium intake over a lifetime. The good news is that research confirms several lifestyle factors can meaningfully influence pulse pressure even in older adults. Regular aerobic exercise, even walking, helps maintain arterial flexibility. Studies consistently show that people who remain physically active into their 70s have measurably more flexible arteries than sedentary people of the same age. A diet lower in sodium is one of the most evidence-backed ways to reduce arterial stiffness. The DASH diet, which emphasizes vegetables, fruits, whole grains, and low sodium, has specific research behind it for improving arterial compliance in older adults. Maintaining a healthy weight reduces the workload on your heart and arteries with every single beat. And not smoking, or stopping if you do, is the single most impactful thing a person can do to slow arterial aging. Here are 3 things to do this week. First, calculate your pulse pressure from your last blood pressure reading right now. Subtract the bottom number from the top. Write it down. This is information you now have that most people your age do not. Second, bring this number to your next doctor's appointment. Ask your doctor specifically, what is my pulse pressure trend over time, and is it something we should be monitoring? That question alone will signal that you are an informed patient and shift the quality of your conversation. Third, if your pulse pressure is above 60, ask whether an arterial stiffness assessment makes sense for you. This is a non-invasive measurement that some cardiologists use to assess vascular AGE. It is not available everywhere, but it is worth asking about. You have been checking your blood pressure for years. Now you know how to read it in a way most people never learn. That knowledge belongs to you now. Use it at your next appointment. If this video helped you, please share it with one person over 65 in your life who checks their blood pressure regularly. They are looking at those 2 numbers every week and probably have no idea this third measurement exists. Subscribe to Reclaim 60 for more evidence-based senior health content every week. Brain health, heart health, sleep, and medications. All explained in plain English with no fluff. And leave a comment below with just one number, your pulse pressure right now. Subtract your bottom from your top and drop it below. I read every single one. I'll see you in the next one.